A traveler's advisory on current bio-risks, Q&A. 1. What is the current situation in Europe? Sept 2025, an early autumn wave of respiratory viruses is circulating, including new COVID subvariants. The initial illness is often mild, so official government advice remains relaxed, with no mandates for travelers. However, there is new scientific information to consider, with the primary reference being the following. The Lancet is a leading scientific medical journal, first published in 1823. Alwyn et al. Comment in the Lancet, Volume 405, Issue 10476. February 2025. 2. What are some effective, simple precautions? The goal is not to be fearful, but to be smart. A few easy precautions can dramatically reduce risk. Mask up. Wear a high-quality FFP2 or FFP3 mask in crowded indoor spaces like airports, planes, and public transport. Ventilate. Choose outdoor seating at cafes and restaurants when possible. Be prepared. Pack a small kit with a few COVID tests, basic pain relief, and spare masks. Hand hygiene. Continue with regular hand washing or using a sanitizer. 3. What is the Lancet article's main call to action for governments? It makes the following urgent appeal. Governments must face the reality that some infections which are largely regarded as only acute cause a substantial burden of chronic illnesses, and must integrate ways to address the challenges that it presents into international, national, and local systems. The health and well-being of billions of people around the world now, and in future generations, depend on this. 4. Does the article give a specific example? Yes, the article uses SARS-CoV-2 as the example of the infection and post-COVID-19 condition, long COVID, as the resulting chronic illness. It provides the major statistic that long COVID is estimated to affect more than 400 million people of the 8 billion people on planet Earth. 5. Why are official narratives about this so relaxed? The Lancet article identifies this as a major historical blind spot. It explains that global health policy has traditionally ignored that acute infections are substantial risk factors for the population burden of non-communicable diseases, NCDs. Health systems are set up to measure acute illness, like hospitalizations, not the slow-motion crisis of infection-driven chronic disease, which creates an information block. 6. Where can I learn more? For a community discussing related topics, you can see link to linktr.ee, 178k followers. 7. What is the final, simple message? A few small, easy precautions can make all the difference and allow you to enjoy your holiday.